Hi, everybody. Patricia Coughlin responding once again to a request by a subscriber to talk about the concept of ego fragility, understanding what is that, how do we assess it, and then how do we treat somebody who has some ego fragility. And to some extent, that's connected to the last video on the graded approach. So for people who have extremely high unregulated anxiety or rely on regressive defenses and really seem to lack capacity, there's a deficit there in observing ego or affect regulation, that will use that gradual stepwise graded approach. So what do we mean by ego fragility? I think this is something that in our profession we have really over-diagnosed. There's a tendency, certainly in psychoanalytic circles, and I think it's kind of spread, to almost assume that patients are fragile, incapable, in need of a great deal of support and help. And this has bled out, into the society at large, where we've literally created a whole generation of fragile kids who can't seem to live on life's terms, who find words traumatic and things like this. So what we really want to be doing is building resilience and flexibility and adaptability. So I think we have to be very cautious that we don't over-diagnose fragility. So fragility, again, meaning an area of deficit, or an entire ego organization that is very, fragile, unstable, easily disrupted. So in order to assess this, we have to look at many factors. So I think, again, one of the problems with this over-diagnosing fragility is that if a patient shows any evidence of cognitive perceptual disruption in the face of anxiety, they get dizzy, blurry vision, lose track of their thoughts, begin to project, they seem to be immediately labeled as fragile. And then the therapy tends to stall out and really operate at that person's lowest level of capacity rather than the highest capacity. So it's not just one data point that you're going to use ever, right, to assess anybody's ego adaptive capacity. You're going to be looking at multiple factors. Of course, you're going to look at where and how anxiety is being channeled. You're going to look at the nature and tenacity of the defensive system. Patients who are truly fragile don't almost have the capacity to mount a good defense. I mean, their defenses are also not very effective. They, instead of reducing anxiety, actually increase it. So people who somatize and are sure they have a brain tumor, people who, again, project their own rage out and are terrified of other people, are not going to be doing well. And that's another hallmark of people who have a fragile structure, is they really can't function very well. They tend not to be able to hold a job or to maintain relationships that are in any way stable. And so you're looking again at anxiety, at defensive structure. And one of the most important things there is to look at whether regressive defenses like projection, like dissociation, are actually the best the person can do. If that's all they have at their disposal, then they truly have a fragile ego structure. And that's quite different than someone who has the capacity to mentalize, to use intellectualizing defenses, to minimize, justify, rationalize, And on occasion, under high levels of anxiety, might again lose track of their thoughts or say, well, you know, I don't understand why you're asking me this. I mean, do you just want me to get angry? Or so they might have a moment of projection there. But again, if they have the capacity to do better, to use intellectualizing defenses and repressive defenses, but regress under pressure to the use of regressive defenses, that's a different picture, right? Than somebody who can only use regressive defenses. So that's another very important thing. Then you want to look at the person's ability to function. Again, can they hold a job? Do they have relationships that are stable and in some way healthy or not? So you're going to be using lots of different criteria. How many symptoms they've had, for how long, how many areas of functioning get affected. Is it their self-care, their relationships, work, everything gets affected by their difficulties? Or again, are there just pockets, what I would call pockets of fragility? So someone who operates, relatively well, or, at a neurotic level, or even a stable character disorder, obsessional or histrionic. But again, under specific circumstances of pressure or high anxiety, might disrupt and resort to regressive defenses or go over threshold with anxiety and show signs of cognitive perceptual disruption. So once that happens, you're also going to want to look at how quickly do they bounce back. Are you able pretty quickly to help them see, wow, it looks like your anxiety really went up there. Let's look at how you're experiencing that inside. And do they reconstitute rapidly? So if that's the case, right, they generally are stable, they might regress and go over a threshold in a particular moment or in a particular area that's very anxiety provoking for them, and then they bounce back quickly, then I wouldn't say this person has a fragile ego structure, right? They might have certain pockets, and you're going to help them really use their resources, again, focusing on their highest capacity to help them in these areas of difficulty. So again, it is to some extent a matter of definition, but I think it's very important to really think about how you're assessing patients and how you think about them, whether you're diagnosing them based on, again, their lowest level of capacity or their highest level. And of course, noting, right, their areas of weakness or these pockets of fragility that would need particular work. So I hope that's helpful. I'm really interested in your views and questions on this because, again, I think it's something that has really had a pernicious effect, not just on our patients, but on society, right? Seeing folks as very fragile and kind of identifying them by their weakest point. So leave comments and questions, and we'll continue the conversation. Thanks.